Hello, my name is Patrick Kocica, and this is my client Liz Maltz. I'm going to do a demo today on how to treat herniated disc. We have, in this case, a double herniated disc, L4 and L5. There's a lateral herniation, and then S1 and L5. There's a ventral herniation. So this is a very complicated case, and I will demonstrate on how to go about approaching that. Also, she had an injury a year ago in which she hurt her neck. So I will also demonstrate an upper body evaluation and treatment at the same time. So Liz has come to us now. This is like her 14th treatment that we've had, and over a 2-month period from when she first had the herniation. The neck injury was a 1.5 years ago, and it never really was properly rehabilitated, so it still gives her pain. And of course, after she had the herniations in the low back, it started acting up again, which is oftentimes the case with spinal injuries. So the first thing I will do is work the upper traps and the splenius capitis and the cervical spine and the shoulder to relieve any tension there before we actually go and treat the side that is getting impinged on the C7 and C6 thoracic outlet and the brachial plexus on actually the left side. So we always want to release the tension on the opposite side first, so that when I get over there, I will have less pressure in my way to work on the site of the inflammation. I'll tell you a little bit about Liz as I work. She is 35 years old. She has had back pain pretty much as far back as she can remember, from when she was 7 years old, and she was rear-ended when they were parked on the side of the road, and she was in a position in which she was turned to the side when the car hit. And ever since then she had back pain and was never properly treated or even diagnosed until recently, when finally, all of a sudden, after cleaning her house one day, the next morning she couldn't move. So we have an MRI, and in the MRI they found 2 herniated discs in the low back, so we know what we're dealing with. In some cases, we have people come in like this, and we do not know what's in there. We do not have the benefit of MRI, but still, we will take an evaluative approach to assess the situation, and that's very important when you have a client like this, that you do not do any kind of therapy that will make it worse, because oftentimes people with herniated disc will have excruciating pain even from just bending down to tie their shoe or even getting in and out of a chair. So normal therapy in many cases cannot be applied. So what we do in Hoshino Therapy, we are a specific therapy for treating people in chronic and acute pain. And there is a way to do that which I will demonstrate here today. Now, when Liz first came in, she could hardly move. We barely got her up here on the table, and now after 13 sessions, this is the 14th session, she is now able to be off the painkillers, which she was on for the first 2 months. We took her off of them about 3 weeks ago, and now she's been stable without any anti-inflammatories or out any painkillers, but she still is in a lot of pain and will need still further rehabilitation. What I'm doing now is I'm going through all the muscle groups in the upper body, releasing any tension or adhesions that I might find there along the way with our 270-point evaluative therapy and diagnosis. What I'm doing here is I'm looking for any pressure points which are particularly sensitive, which will tell me about where I need to work in order to relieve the pressure on the cervical spine. A lot of people fail to recognize how important that is to work not only on the site of the injury, but even more importantly, around it, on the muscles and the joints surrounding it, because it is there where the dysfunction starts to spread. And oftentimes the site of inflammation, you can only work on it so much. So the dosage is very important. If you overstimulate an inflamed nerve, you'll surely make it worse.